Welcome back. It can be embarrassing and uncomfortable, and the heat doesn't help. We're talking about excessive sweating, and this morning Dr. Rocco Piazza is here, a local plastic surgeon with the Piazza Center, to talk about it. Good morning to you.
Good morning, Erin.
Good morning. This excessive sweating, it has a name. It's an actual condition.
Right. It's called hyperhidrosis or severe axillary hyperhidrosis.
So how do you know that you have it? How do you know it's more than normal?
Well, typically this type of patient is somebody who chooses to wear dark clothing most frequently. They notice that they have to change clothes 2 to 3 times a day. They're bringing their antiperspirants and powders and things like that with them throughout the day, and oftentimes this becomes something that really is interfering with activities of daily living. So it affects basically how they go about their day.
So through history, I mean, what have been the solutions to this, and are there treatments?
Well, there are a number of homeopathic solutions. Apple cider vinegar is one, and some other things. There's prescription medications that can be used as well to help decrease the amount of sweating produced, predominantly in the axillary or underarm area. And I think what's really fascinating is that you've been using Botox for 11 years now, and most often it's used to treat the frown lines, those pesky lines between the eyebrows. And so what we've seen is actually with the recent FDA approval last year, I believe it was, with regards to use of Botox to help decrease underarm sweating, we've seen a significant improvement in patients, especially their quality of life.
Interesting. We've got a couple pictures of the procedure here that we can pop up. This looks like an underarm area. Tell us what's going on here.
So basically what we're doing is we're marking out that area and then planning our injection sites, and we inject Botox just underneath the area of the skin, and what it does is it essentially blocks the chemical signal that comes from the nerve which stimulates the sweat glands to produce sweat. And it will last for up to 6 to 7 months, which is really nice for someone who's constantly planning what they're going to do every 2 to 3 hours during the day. And that's why I think, Erin, this really does improve quality of life for patients with excessive underarm sweating.
Does it hurt?
Well, with any injections, there's always use of a needle. The thing to remember is that this is actually a very, very small needle, kind of like what patients give that are diabetic, that receive insulin. So it's a really, really small needle. But we also use a topical numbing medication prior to even injecting this area. So I think, the question really is it worth it? And I think absolutely. Absolutely.
What's the cost, and do insurance companies cover this type of procedure?
Well, that's a great question. It depends on a number of things. Insurance may cover it depending on a patient's benefit plan, depending on what a patient has experienced in the past. Have they used and failed prescription medications? Is it really altering activities of daily living? And all of that stuff has to be really well documented with a board-certified dermatologist or board-certified plastic surgeon. And once a patient's met that goals, we can seek what's called pre-authorization from an insurance company. Otherwise, it's about $500 per underarm.
Got it. And you said about 6 to 7 months. It'll last about 6 to 7 months. So after that, if you want to get those results again, you come back in.
That's correct. Okay.
Well, Dr. Piazza, thank you so much for being here this morning. We really, really appreciate it. Some good information. And